Very good evening with Olivia Quay. I'm Haryanto Diman. Now we're coming to you live from the Straits Times newsroom.
Given the recent spike in new Covid-19 community cases and the emergence of the first hospital cluster, Singapore's Covid-19 multi-ministry task force has announced new measures and provided some crucial updates.
More measures at Tan Tock Seng Hospital. 4 wards have been locked down following the detection of a cluster of 13 Covid-19 cases there.
When we lock down a ward, there is no in or out movement from that ward. So there is restricted movements for patients and staff, only for very essential testing. For example, they require a test in our radiology department. And even then, when we do move them, we take full precautions in moving them. But in all essence, there is strict restrictions on entry into the ward, so we will not admit any further patients into that ward, and we will have a dedicated group of staff taking care of those patients in the ward.
All close contacts of the identified cases, including patients, visitors and staff who have been in the affected wards, have also been placed on quarantine.
Health Minister Gan Kim Yong said that the hospital cluster is being monitored very closely, and if there's widespread transmission, Singapore will introduce more stringent measures to contain the situation.
Our testing is ongoing, and we expect to detect more cases in the coming weeks, in the coming days. To reduce spread from undetected cases in the community, we will also close all public places visited by the cases during the likely infectious period for 2 days for cleaning, and this will also facilitate testing of the staff and workers at these affected areas. We are monitoring this particular cluster at Tan Tock Seng Hospital very closely. The next few days will be critical. If we find many more cases that suggest widespread transmission, we will have to introduce more measures to break the chain of transmission. These recent increases in cases is yet another reminder that the virus is alive and circulating. And we will have to continue to be vigilant because we remain vulnerable once we let our guards down. We must continue to be socially responsible and stick to the safe management measures, including for those who have been vaccinated. Let us continue to work together and remain vigilant and bring the local infections under control quickly.
All hospital staff and patients who were in the main block levels 3 to 13 from April 18th to 28th are being tested. And the hospital has also stepped up clinical surveillance of all inpatients who may develop fever and acute respiratory infection symptoms.
We have cast our net wide to prevent further spread. As of yesterday, we have started mass screening for all inpatients and staff working in our wards. This is to cast our net wide in order to contain any potential and hidden risks. During this period, we have about 1,100 inpatients and 4,500 staff in our wards working across various shifts. This includes doctors, nurses, allied health professionals, housekeepers, and many other support staff. We will swab and test each and every one of them. All our inpatients will be swabbed by this evening, and all 4,500 staff will complete their swabbing by this weekend.
In addition to testing current patients and staff, authorities will carry out surveillance testing for 3 groups.
These are discharged patients, visitors to the hospital on or after April 18th, as well as people who had been to or who work at the public places that the hospital cluster cases had visited during their infectious period.
And to reduce the risk of infection to the wider community from undetected cases linked to TTSH, all public places visited by any TTSH case will be closed for 2 days. This for cleaning as well as to facilitate the testing of staff at the affected places.
These places were visited by cases during their likely infectious period, while the full list is on straitstimes.com.
The agencies will be approaching the operators, owners of these venues, to have them closed. And I presume most of it will be done over the weekend, Saturday, Sunday. In some instances, maybe not, but it will depend on the venue operators. But we'll want to do it as soon as possible, and we'll put out the notifications in due course. Some of them are F&B outlets. Some of them are places of worship. We will close them for 2 days for deep cleaning and to facilitate the testing of staff working at these places. Beyond that, for people who may have been exposed to these public places at the time when the infected cases were there, these are not the close contacts, because the close contacts would have been informed, notified, and we would have put them on quarantine. But through the Trace Together and Safe Entry system, we know that there are people who might be exposed because they were there in these public places at about the same time when the infected cases were there. So we will send SMSs to all of the people with possible exposures to notify them and keep them on alert. In addition, we will also alert them and encourage them through the SMS to get themselves tested. So we'll send them instructions on where they could possibly go for testing, and the testing will be free of charge.
Well, the task force also said there is no obvious link yet between TTSH and the wife of the ICA officer, who's a staff nurse at the hospital. The ICA officer is involved in a separate cluster with 7 other cases linked to him.
In the light of the new clusters and rising local cases, the task force urged the public to limit social gatherings to twice a day, with a cap of no more than 8 people per gathering.
Additionally, starting from tomorrow, the occupancy limit at malls and large standalone stores will be reduced to 1 person per 10 square meter of gross floor area. The odd and even date entry restrictions on Sundays for popular malls like Lucky Plaza and Peninsula Plaza will be reinstated.
Campsites will be closed to the public as well. The same goes for outdoor barbecue pits, including those in parks, HDB estates, condominiums and country clubs.
And for attractions, with effect from May 7th to 14th, all attractions that have received prior approval will be permitted to operate at 50% capacity. This is a reduction from 65%.
For workplaces, Education Minister Lawrence Wong said employers should allow staff to work from home as far as possible, and social gatherings at the workplace should be avoided.
Border controls will be tightened further as well in response to a sharp rise in cases in Bangladesh, Nepal, Pakistan and Sri Lanka. All long-term pass holders and short-term visitors with recent travel history to any of these countries will not be allowed to enter or transit through Singapore. Now, this will come into effect from 11:59 p.m. this Sunday.
These tighter measures will also apply to those who had obtained prior approval to arrive here. But returning Singaporeans and permanent residents are exempted from these rules.
Travellers coming in from these 4 South Asian countries must complete an additional 7-day stay-home notice at dedicated facilities if they haven't completed their 14-day quarantine by Sunday night.
Meanwhile, tighter measures will also be imposed for travellers arriving from Thailand. They will have to serve their 14-day SHN at dedicated facilities, which they can't opt out of even if they have obtained prior approval.
You can visit straitstimes.com for more details on today's press conference. You can also watch the full press conference on our YouTube channel later tonight.
Subscribe by hitting the red button below as well. I'm Haryanto Diman with Olivia Quay. Have a good night.